Hello, welcome to Legislative Report. I'm State Representative Kate Harper of the 61st District in Montgomery County. Today the report comes to you from the Montgomery County Community College, where I was privileged to be part of a ceremony with Governor Tom Corbett to sign into law one of my bills, House Bill 43, which aims to get givenhour.org licensed mental health professionals licenses so that they can volunteer and give an hour to veterans and their families who need their services. Let's listen to the ceremony.
Good afternoon. Welcome to Montgomery County Community College. I'm Karen Stout. I'm president of Montgomery County Community College, and I want to welcome all of our distinguished guests, and I want to thank you for joining us to witness Governor Corbett sign a very important piece of legislation on behalf of Pennsylvania's veterans. Montgomery County Community College is honored to host this signing. Montgomery County Community College is devoted to providing veterans with the education and support that's so important for their transition from active duty into civilian life. And we're part of a 14 system community college in Pennsylvania that's very versatile in supporting the educational and quality of life needs of the Commonwealth. And we're proud of the work we do, and we're proud of the support we receive from the Commonwealth of Pennsylvania to do that work. We have several guests joining us today, in addition to the governor and Representative Kate Harper, who you will hear from shortly. We have Representative Tom Mert, Representative Mike Verb, Representative Matt Bradford. We also have Pennsylvania Adjutant General Wesley Craig. That would be you. So that's the distinguishing factor. Thank you for joining us. Veterans services are very important to the college's Student Success Initiative. And in this last fiscal year alone, we served more than 700 veterans returning to college at Montgomery County Community College. And we're very proud of that. And we've grown more than 130% in veteran student population since 2007. And we have a few of our students with us today. Our veterans support team includes a number of professionals and from academic affairs, from businesses, and from our student affairs area. And together they work very hard as a supportive community to help students gain success in their academic studies, but also in gaining access to employment, which we know is one of the continuing challenges for veterans. In 2012, we opened our Veterans Resource Center. We're one of the few community colleges in the country that has a center dedicated just for veterans. It has a student lounge, career counseling opportunities, opportunities for study groups, and even hosts yoga classes. And we will, I think later, get a chance, the governor, I will take him over to take a look at that. I want to introduce a few of the members of my team that support the Veterans Center. Dr. Anne Marie Donahue, Associate Professor of Psychology and Faculty, advisor to the Student Veteran Organization. Thank you for your work. Anne Marie. Justin Machane, a Marine Corps veteran with a master's degree in political science, who's the coordinator of veteran services at the college. We'll meet him later. And with their leadership, Montgomery County Community College is ranked among the top 5% of colleges in the country in the work that we do with veterans. As Governor Corbett and Representative Harper and another one of our guests, Dr. Valentine, know very well, being committed to veterans means that we have to seize opportunities at just the right time, just the right place to support their transition. We did that earlier this month when we became part of the Yellow Ribbon program, and now we are able to help out-of-state veterans access services at Montgomery County Community College. So we at Montgomery County Community College applaud the governor's efforts and applaud Representative Harper's efforts, and we are again privileged to host this signing. It's now my honor to turn the floor over to our governor, the Honorable Thomas Corbett. He served as a member of the Pennsylvania National Guard's 28th Infantry Division from 1971 to 1984, rising from a private to captain. He's a former Attorney General. and I'm just very privileged to have him here. The last time I met the governor was in Montgomery County, but at a business. I don't know if you remember, we were at ASI Technologies in Montgomeryville celebrating the 1 millionth participant in the WEDNET program, which is another program that the Commonwealth has supported under your leadership. So, Governor, welcome to Montgomery County Community College, and the podium is yours. Thank you.
Thank you, President. President Stout, thank you very much for the kind introduction, and good afternoon. And thank you to the representatives who took time out of their busy schedules. I know a lot of them are out there this time of year knocking on doors, introducing themselves, particularly since they have some new districts to maybe their new constituents. So thank you all for joining us. I particularly want to thank the men and women of the Pennsylvania National Guard who are here with us. General Craig, thank you very much. Hopefully we're not taking too much time out of your busy schedule and their busy schedule with the Guard. I want to thank you for all that you have done to protect the citizens of this country and protect the citizens of Pennsylvania. Having been a member of the National Guard in a much different time than what we are in today, I certainly appreciate every time I see one of our soldiers, airmen, airwomen, across the board. Every time I get a chance to go up and just say thank you for your service, I take that. And I'm going to do it right now with all of you. Thank you very much for being here. We're here today really to reaffirm an idea that not all devastating injuries that occur to our wounded warriors can be fixed with a Band-Aid. Every day, our brave men and women who have served in Iraq or Afghanistan and around the world are coming home. We see more and more coming home. They stood for us between freedom and chaos, and they protected us during times of great uncertainty from evils around the world. They have served this country honorably and served bravely, and they've served gallantly. Yet sadly, many come home with lingering, non-visible scars. The bill that I am signing today ceremonially is a demonstration of Pennsylvania's commitment to making certain that our military men and women get the behavioral health services that they need and that our basic sense of decency demands that we provide. This bill, House Bill 43, amends the Volunteer Health Services Act to allow volunteer licensees to provide mental health services in approved clinics. It allows volunteer licensees to provide that mental health service to military personnel and their families outside of the clinics upon referral from approved organizations. This new law also allows our psychologists, social workers, marriage and family therapists, and professional counselors to obtain their own volunteer license, and establishes a procedure by which the Department of Military and Veterans Affairs designates the approved organizations. Excuse me. Prior to this legislation, a practitioner was only allowed to volunteer their services within the confines of approved clinics. Now we can bring care wherever our wounded warriors may need it. A few weeks ago, I had the opportunity to attend an award ceremony, I guess about 6 weeks ago, General, at Fort Indiantown Gap during what's called a Joint Commander's Call. I had the honor of presenting medals to outstanding men and women in the National Guard of Pennsylvania. Looking out over the audience, I couldn't help but be in awe of the courage and the dedication that they exhibited on behalf of our nation. Today, I have the same feeling as I stand here with these men and women who have served every day and dedicated their lives to the idea that is greater than themselves. We can never forget their dedication nor their sacrifice. I do want to thank the representatives, Representative Harper and Greenleaf, for helping make Pennsylvania a place where we work every day to honor those ideals. I do also want to thank the entire legislature, because this was a unanimous bill in both houses. It was a bill that came about because we didn't really understand before, years ago, that we needed something like this. But with the change of our men and women coming home, we recognized that we needed the change. And that recognition was a result of Dr. John Valentine and the fantastic staff here at the Veterans Resource Center for their efforts in helping bring much needed services to our veterans. Excuse me. Through their work, This bill that I'm about to sign will allow the Commonwealth to place those who serve on our behalf and to allow them to get the services they need in a much more convenient way and much greater accessibility and get the best possible care. Thank you all very much.
Thank you, Governor. I've had the pleasure to introduce Representative Kate Harper on numerous occasions, most recently at our Earth Day event when we were celebrating the introduction of a new natural gas-powered shuttle between the two of our campuses. Representative Harper has served the 61st Legislative District for 14 years. She's known at the college as one of our founding mothers because she helped us found a very important and very successful program to help women transition into owning and operating and being successful as entrepreneurs with small businesses. And as a result of her leadership, we have many more female-run businesses in Montgomery County. I'm very happy that because of redistricting, the Central Campus comes back into Representative Harper's district. We're proud of her advocacy for veterans' health services, and we're delighted to have her back on campus. Ladies and gentlemen, Representative Kate Harper.
Thank you, Dr. Stout. It is my pleasure to welcome you to the once and future 61st Legislative District, Governor Corbett, and to the Montgomery County Community College, of which everyone in the county is very proud as a premier community college in the Commonwealth and maybe in the nation by some standards. So I'm happy to be here and happy to have you here, and also to welcome you to the Veterans Resource Center here at the college. I'd like to give a shout out to my legislative friends, Representative Matt Bradford, Representative Mike Verb, and Representative Tom Mert, all members of the Pennsylvania House of Representatives and also representing Montgomery County, and in effect, all the people from the community college. So this bill passed unanimously. Notwithstanding that, it took 4 years to get it done. Also like to give a shout out to some people who have been very helpful to veterans. Professor Dr. Anne-Marie Donahue over there from the Resource Center. I've known Anne-Marie for many, many years, and I know that she does whatever she can for the veterans. And also I'd like to point out Harry Gabora, another local veteran who is, I think, the leader of the Bolton-Dixon Post in Fort Washington, and also helpful to veterans with financial careers, which is often a good way to go when you get back. House Bill 43 is just a little effort to make sure that our returning veterans and their families get what they need from us, the citizens for whom they've put their lives on the line, for whom they've run into battle, for whom they every day fight to defend the things that are intrinsically American, like the rule of law and the democracy. We owe the veterans and their families whatever they need, and this is just a small part of that. Sometimes what they need can be found right here at the community college and the Veterans Resource Center. And sometimes it can't. Sometimes it needs to be a sympathetic but trained and listening ear who can offer support of a different kind. House Bill 43 allows givenhour.org, a nonprofit organization, to have volunteer licenses available for mental health professionals who can provide counseling to veterans and their families, even if they are not in an approved clinic or in a clinical setting. And this is important because for veterans and military personnel, the stigma of asking for help sometimes dissuades them from getting what they need. Pennsylvania licenses doctors and healthcare professionals to ensure the public that they are getting professional, educated medical practitioners when they need to seek treatment. And House Bill 43, soon to be Act 86 of 2014, extends volunteer licenses to mental health professionals who participate in the Given Hour program or similar programs. And the inspiration from the bill came from our own Dr. John Valentine, a retired licensed psychiatrist who embraced the Given Hour approach and wanted to make sure that Pennsylvania's veterans who needed counseling or other mental health services could get them in the community, in places where they felt safe and able to do so. Working with Senator Stuart Greenleaf and me, Dr. Valentine was quietly supportive for the 4 years that it took to change the law. As an advocate for the Give an Hour program and the good that he and other mental health service professionals can do for men and women returning from Iraq and Afghanistan, struggling to fit back into a family or back into a community, so focused on other things that they hardly knew what to make of a soldier's experiences or what to say to him or her. Knowing all that, Dr. Valentine kept pushing to get the bill passed. So we owe a great debt to our veterans, and we owe a debt also to volunteers like Dr. John Valentine, who, recognizing a problem, seeing a solution, got together with the Pennsylvania General Assembly and Governor Corbett to make the two things fit together and work better for our veterans. So I'm very pleased to introduce Lower Gwinnett resident, a neighbor, Dr. John Valentine.
My story with this has two roots. The first is personal family. My great-grandfather was in the 157th Regiment of the Pennsylvania Infantry in the Civil War. He was at Weldon Station, he was at Cold Harbor, he was at Appomattox. After returning from the war, after the Grand March, he worked for the Pennsylvania Railroad as a switchmaster and came home and smoked his pipe on the porch in West Philadelphia with a 1,000-mile stare, I'm told, for the rest of his life. The 1,000-mile stare that is typical of the combat veteran. My dad was a master plumber and was assigned, tried to enlist in World War II, but was told to go to the U.S. Navy Yard and work on submarines, which he did. He became the master steam fitter and took unarmed submarines out into the Atlantic on sea trials and himself saw burning sailors from sunken and sinking oil tankers coming up the Atlantic coast. And he knew what the 1,000-mile stare was also. So that's the personal part of this for me. The professional part occurred 4 years ago when I tried to join Give an Hour, and did join Give an Hour, though I'm inactive until now. I got a call shortly after I joined from the worried mother of a Marine recently returned from Iraq, from Fallujah combat. And she was very concerned about him. She lived in Fort Washington. So I then applied for this volunteer license and was very kindly told by the State Board of Medicine that it had to be in an approved clinic. And I also had to get all kinds of malpractice insurance per veteran seen. So, and that is the point at which this story really begins and the involvement with the bill. This bill encourages Pennsylvania's currently serving military or their loved ones to overcome the reluctance and stigma of receiving mental health services. Now, on referral from the nationwide agency, Give an Hour, headquartered in Bethesda, Maryland, retired licensed mental health professionals, such as myself, will be able to join the Commonwealth's psychiatrists, psychologists, psychiatric nurses, social workers, and related areas, already offering through giveanhour.org many hours of free outpatient care at different anonymous and confidential sites, such as library tutoring rooms or church basements. In our state, the majority of those protecting us in military uniform are in Pennsylvania National Guard or Reserve units. Many of them have been deployed to combat areas multiple times. That's 4 or 5 tours in a few cases. In our country's 2 longest wars, possibly a third have experienced traumatic brain injury, post-traumatic stress disorder, military sexual trauma, and/or alcohol or substance abuse. In addition, the impact on their families from all the long periods away is thought to be substantial. Given Hour's accredited and licensed professionals in all 50 states and our territories have logged about 140,000 free hours of care for America's best or their families since 2005 when it was founded. And now here in Pennsylvania, more professionals will be able to give an hour a week, meeting this great need. This service may contribute also to preserving military careers and retention in America's all-volunteer military. On behalf of Give an Hour and myself, I would like to thank Governor Tom Corbett, my state representative Kate Harper, my state senator Stuart Greenleaf, and all their staffs for getting all hands on deck around this worthy cause. Those who defend us deserve it. Thank you. If they have some sort of difficulty with emotional difficulties, or their family members have emotional difficulties, or substance abuse or alcohol problems, specifically, it doesn't have to be limited to the usual military problems that are unique to the military: post-traumatic stress disorder, traumatic brain injury, military sexual trauma, or alcohol or substance abuse. But often that's what causes them to reach out to giveanhour.org, which all the military commands know about. This is a program for serving military and their families. And in Pennsylvania, most of these are in our Pennsylvania National Guard or our reserve units. There are some active duty, obviously, but it's mainly Guard and Reserve. And many of them have had 4 or 5 tours of duty in combat zones and in what are now America's longest wars. And the impact on their families from these long tours away is also very significant and is causing a lot of family distress. We think, so anyway, they can be seen, the volunteers who are licensed, fully credentialed professionals, psychiatrists, psychologists, psychiatric nurses, social workers, marriage and family therapists, related disciplines, occupational therapists, all kinds of different other disciplines, can, through Give an Hour, get a referral of somebody, screen them, set up some sort of off-campus meeting site. I plan to use my local public library's tutoring rooms, or the finished basement of my parish church rectory, St. Joseph's in Ambler, and see these people anonymously and confidentially. The idea is they be seen usually an hour a week, really for as long as they need to be seen, but with a typical format of roughly 10 sessions, more if they need it, and hopefully help them and help their families cope with what are called the hidden wounds of war. So it's thanks to Representative Harper and Senator Stuart Greenleaf and their staffs and the governor's office and Give an Hour itself that we've been able to get this done.
A visible wound is so much easier to treat than sort of the hidden wounds, and people have come back from war for eons and millennia, and you couldn't tell. You sort of knew something was off. And the stigma is still there, but I think it's finally really starting to come down where people can really raise their hand and say, hey, I could use some help. So it's nice to be able to then have the resources without, there will always be paperwork. This is the government. But to not have that paperwork, or to minimize the paperwork and speed up the actual caregiving, I think that's very important. It's always kind of an interesting balance between, since it's other people's money that we're using for this, and sort of maintaining state or federal control or governmental control over the issue, versus, hey, let's try something new and interesting. Somewhere there's always a line that has to be drawn, that says this is a valid approach or this is an appropriate use of our funds and times and resources. And this is kind of new and innovative. I don't think there's ever a complete answer to that. Sometimes, without innovation, you don't get anywhere. Trying to save the old problem or solve the old problems with the same old solutions doesn't always work. But no, I think this is good. Again, I think it's destigmatizing, the ability to destigmatize and to just kind of go, you know what, I could use just a little bit of a tune-up. I'm not sure what this is, and let me see what's going on here. Is great.
The doctor who sponsored this bill really came up and did a great job explaining it. This will allow retired mental health professionals to basically volunteer their time by getting temporary medical licenses, even though they're retired, in approved clinics to do mental health counseling for soldiers and airmen and Marines and veterans who have come back from combat. This helps, and they can do it anywhere. It doesn't have to be in an office. It could be, as he said, in a church basement. It can be in a library study room, anywhere where the soldier, airman, Marine feels comfortable. And that means a lot because there's a stigma. If you're a military person like me and you have a traumatic brain injury, you don't want to admit that you might be having a mental problem. So this is an easier way for them to get there, and it expands the coverage of mental health professionals. It's a great bill. And the fact that it was passed unanimously by the House and the Senate is tremendous. It says a lot about the legislature, and they recognize this is needed as well. We know we have several hundred in the Pennsylvania Guard who are suffering from PTSD and or traumatic brain injury, which usually triggers a PTSD. So yes, I've had a number of people who have gone to counseling, either through the VA or to personal counselors themselves. So this is very much needed, and I'm glad they've come up and done this today.
Many of the wounds and injuries that are sustained by our military personnel who have been deployed in Iraq and Afghanistan and around the world are not physical. They're mental, they're emotional. And House Bill 43 empowers our medical community to provide volunteer therapy and assistance to our men and women in uniform who might suffer from post-traumatic stress disorder or from another mental or emotional problem. And these situations are plentiful with the deployment of our military personnel at such a high tempo. And we are very grateful to the medical community for stepping forward and agreeing to participate in a program like this. One of the great things about House Bill 43 is that it empowers healthcare professionals that are licensed to give psychotherapy, is that they don't have to give it in a traditional clinical setting. They can meet with a patient or a client in a setting such as a free public library or perhaps a basement of a church or another public building in a private area where they can discuss the issues and give therapy to the soldier, the sailor, the airman, the Coast Guardsman, or the Marine, or their family members that might be experiencing some problems. In the military, for someone who may have a mental health issue or challenge, it could be a showstopper, a career ender. And many of our military personnel are not always eager and are frequently reluctant to seek counseling and therapy. And we think that this House Bill 43, we're positive that is going to encourage our soldiers, sailors, airmen, and Marines and their families who need therapy, who need assistance to seek it.
Well, that's all the time we have for today's legislative report. I'm State Representative Kate Harper. If you have any state need or anything I can help you with, my contact information will appear on the screen in just a moment. Get in touch or follow me on Facebook.